Thank you so much. I come from Tampere University, and I am also a registered nurse, and I have quite a long work life behind me as a pediatric nurse. I started university studies in 2011, and I graduated with a master's in health sciences 2016. And I have been researching actively the phenomenon of child maltreatment since 2013, so 10 years, more or less. And I started my doctoral studies in 2021. And my research topic is the validation and feasibility of the family needs checklist from the perspective of parents and social and healthcare professionals in the prevention of child maltreatment. So my research concerns quite highly the prevention side of the child maltreatment. So I tried to follow this what was asked from me to do today, and I tried to be quite short. I'm just sharing thoughts about just a quick timeline of my doctoral research and research ideas and actions in the future from the child maltreatment prevention perspective, and also the collaboration within the internetwork and research challenges. Just shortly, 20 minutes is 20 minutes. So in my study, the background is that the child maltreatment, we all know that in a family, it has a lifelong and devastating consequences for a child, physical, mental, and social health, affecting profoundly their future. And there has been lack of an early prevention instrument of child maltreatment based on multidisciplinary international research evidence. And we in EU founded ERICA project. We made an instrument of the family needs checklist that was developed, and that is based on the Finnish clinical practice guideline. I'm not sure if you are delivering these slides, but you can go here. The first one is my first dissertation article, where we did the literature review, and the second is the ERICA project page that I think it's under the enter site. So I have to change now. This is the guideline that we have done. This is the basis, and we did a quite extensive literature review. It was systematic, and we reviewed only the reviews. It was a review of the reviews. So that's why we had to, because there was plenty of information regarding child maltreatment from different perspectives. So we were able to gather only the reviews. And this guideline, it serves as a basis for the family needs checklist. And this English version is a shortened version of the Finnish clinical practice guideline that we updated and published in 2022. And the aim of this guideline is to improve the consistency and quality of the identification of child maltreatment and conditions that may increase a risk for child maltreatment with the help of provided knowledge. Behind this, we had the research question, and it was that what kind of factors and circumstances increase the risk of child maltreatment in the family. And let me see if I have some notes here for me. So in Finland, this guideline is targeted for any professionals working in the social and healthcare sector, students in the field, as well as those who encounter or care for children age under 18 or their families, or still for those who are responsible for providing training for social and healthcare professionals. Be used in occupational healthcare, mental health, and substance abuse services for adults, for example, and social services for children and adults. It's quite a universal kind of info pack about what child maltreatment is and what are the guideline is also recommend for any organizations providing services aimed at children and families, including education institutions, daycare centers, parishes, associations, and non-governmental organizations and municipalities that offer services and recreational activities to families. So quite low. I mean, it's quite primary prevention to guide and info pack. And it can also be utilized in the development of preventive and early support services and violence response services in the well-being services counties. And the evidence provided in this guideline can also be applied and modified internationally. And of course, it's going to be updated in every 5 years. And we have concepts that are included in this guideline. There is this child maltreatment as a concept, and physical and emotional maltreatment, neglect of the child's needs and basic care. We do not have sexual violence because we already have a guideline for that in Finland, so that's why we excluded that. Also, the one concept is intimate partner violence and exposure of a child to IPV, so intimate partner violence and exposure of a child to domestic violence, and child-parent attachment is one concept, and risk factors for child in family, and risk assessment for maltreatment, and protective factors for child maltreatment. And as you can see now already, child maltreatment is quite a very broad phenomenon itself. But these are all considered in this guideline. So here is the quick timeline of my doctoral research. You know, we have used the winters the approach for checklist development, and Winters with his partners, they established this mode, and we utilized that. It's actually the only one we found, and it was quite good. And the checklist is not as it's not as demanding as any screens or other kind of. It's quite a simple checklist. Is probably the lowest level of trying to identify something or try to remember something, because we also saw here that we need to deliver knowledge to the professional and also the families, and the checklist is something that we can use for all purposes. And there was a 3-phase development process, including the review of the existing literature that we did in this guideline update, and also understanding the needs and workplaces of the users, including a multidisciplinary group in the design. And this was done in the ERICA project that I showed you earlier. And then we use an iterative approach for the rigorous pilot testing and validation of the checklist. And here you can see we have ethical approval for my dissertation. It's ethically approved, and I have this number 3 is interviews and survey of the parents. This is something I have done already, and they are all experts by experience. And the research question for them was that how do experts by experience define the risk conditions that cause child maltreatment and its significance for their own and family members' well-being. So I got 20 life stories from childhood to adulthood, and this is the data I have been working with. I have done now a deductive analysis, and I'm going to go to that because I'm going to show you the matrix that I have for that. But also they evaluated the family needs checklist and its suitability for the prevention of child maltreatment. This was kind of a family perspective for the information that the checklist is giving them, how the wording is the wording right, and so it's not the content but how it's expressed to families. And I have modified this checklist now, and it's delivered for the use of the social and healthcare professionals. So they use it in the different services, in public services and in private services. And then I will interview them. And what is the research question for them is how do professionals perceive the entirety of the checklist and its applicability or to the prevention of child maltreatment based on client situations. So the clients, they are not part of this research, only the professionals. And I'm going to interview them this spring, and then I can finalize the checklist. So actually, this is the timeline in short. So this is the matrix that became evident when we did the systematic review, and we found that there are 3 categories in the child maltreatment phenomenon in the family context. So there are risk factors that are concerned with parent or caregiver and family situation and child. And as you can see, there is a lot of mental health and well-being linked risk factors, or if they are not, for example, this is experience of stress is already a mental well-being factor, but also physical problems and all the, for example, difficulties in interpersonal relationships. This can cause mental well-being problems of many kind. So they are all nearly all linked somehow to mental health and well-being issues. This is what I mean by that. And also the family situation, there are nearly all of them that are linked to mental health well-being of the parent, both parents. And with the child, of course, there is, if the child has a disability or autism or ADHD or difficult behavior, we all know that it causes distress and burnout and very, very tragic mental well-being and health problems. So this is actually very multi-level the phenomenon, and I'm trying to figure this out little by little. This is not even 1,000 pieces puzzle, but even more. So the research ideas, I think that child maltreatment dilemma cannot be solved by any academic discipline alone, because it's so broad phenomenon, and it just cannot be done by one discipline alone. And mental health is seen as a central factor in child maltreatment and its prevention. And mental health is linked to parental, family, situational, and child-related risk factors, as I told you earlier. And in child maltreatment prevention research, the person must be looked at through the totality paradigm of the physical dual lenses, where parts are integral to the wholeness of the person. By this, I mean that in nursing science, I just want to clarify that, may I say here that in nursing science, the dominant orientation of the human perception is holistic. And this means that it looks the person through the totality paradigm of physical, psychological, and social and spiritual lenses. And therefore, in nursing science, theories can be classified into multiple influential paradigms like systems, interactional, behavioral, or developmental, looking at the same things from one or many different perspectives. This is why this becomes quite difficult, or no, it's not impossible, but it must take one stance at a time, or we need to go deeper to one perspective at a time to get a coherent theory, and that's and then also in nursing science, we recognize the simultaneity paradigm, where the person is seen as an irreducible whole and each part affects other parts. So I think this is probably with your disciplines, it's similar with you. So what else? To be able to understand the family situation, we need to look at this as a whole. So the family needs checklist is meant to see all sides of these situations that I mentioned you, these three categories. It includes all these, and it's available in the internet, but it's modified now only in Finnish, because I'm doing the research, and I have modified it now only in Finnish. But of course we have multicultural Finland as well. So in the final stage, we will we will provide and we will update the English version as well, and maybe we add other languages. For example, Arabic is some already requested that we would need Arabic translation for that, and also for the European directive of availability for all, we need to consider also the deaf and the blind and every person and every parent in this process, and it will come. And I will do. I'm actually done this inductive, and with this theory base, I have done deductive, and we will proceed to abductive methods as well.